Hey, Don.
What's up?
Why are you here? What are we doing today?
Well, I have some back pain with standing long periods of time. It's not a huge issue, but it has been bothering me for quite some time. So I got an MRI done and I was told I have degenerative disc disease.
Yeah, how do you feel about that?
Seems scary.
Yeah, doesn't it?
It really does.
Well, I think we do a little assessment to figure out what your body's liking and not liking right now. Like, the fact of the matter is with degenerative disc disease, there's a lot of things you can do. There's a lot of rehab interventions you can do that'll make you feel better pretty quickly. So let's see if we can find some today.
That sounds great.
Okay, so go ahead and stand for me. We're just a little bit of assessment to see how you're feeling.
Okay.
Can you feet together, bend forward as far as you can? Come on back up. How do you feel?
Those feel really tight.
Where?
My hamstrings, like kind of almost all down my legs.
Both?
Both of my legs, yeah.
Okay. No numbness tingling anywhere.
Mm-mm.
Can you reach overhead as far as you can? Reach to the stars.
Oh, that sucks.
Yeah, where do you feel that?
Just kind of my whole low back. There's like a pinpoint spot a little lower too.
Right in the middle?
But then the whole thing sucks.
Okay. Can we see you squat, feet shoulder width apart, and turn your toes directly facing me? Good. Hands behind your head. Squat down real slow. Oh, your knees are so quiet. One more time. Okay, does this bother you at all?
Not really.
Great. Go hands in the air one more time. Reach as high as you can. Squat down again.
That hurts my back.
Okay, got it. All right, so why don't we try first then to establish, we'll call it a movement medication, a first aid, if you will. It should make some of these movements that you just showed us probably feel better today. It won't be perfect probably, but it'll just be a good step in the right direction.
Sounds good.
So why don't we first start with let's go skin rolling.
Okay.
Okay, can you, what you're gonna do is, if you can grab down into this region, and both hands, I want you to grab and try to lift the skin. There you go. It might be hard to grab. There you go. You already know what you're doing, don't you? Grab it, wiggle it.
Might
So,
have done this a few times.
Side to side, up and down. And I want you to even do a little bit of like forward backwards with your spine too, if you can. It doesn't bother you to do, does it?
Mm-mm.
See if you can extend back really far even. There you go. And do a bunch of that.
Oh, I feel like I could go further when I'm holding on to it.
Yeah. Good thing that you're going to go home with yourself and you can just do this all day.
Go home with myself? Can I leave myself here, please?
Nope. Good. All right. Perfect. So let's go ahead and stand. It might be crazy to think this might help, but go ahead and reach over your head, reach to the stars and see how you feel. You actually moved further.
Oh, that actually does feel better.
Yeah, you look like you moved a lot further. So last one you had, what was here, and then reach up, squat down. It looks like a lot of extension things bother you.
This one still kind of sucks, but it doesn't hurt as much in the lower now. It's just kind of upper.
Okay. Do one more squat for me. I just want to check real quick. Hands
Arms
behind
up.
your head. Okay, go ahead and stand back up. We're going to lay on your side then, facing that direction. It looked like your left limb was a little lazy.
Okay.
Okay, lazy left limb syndrome. And so we're going to challenge this left limb, particularly probably the left glute. My theory is that if we do this, we get that left glute working really well, then your low back will stop taking so much of a hit.
Okay.
Can you push my finger into the floor? There you go. And then roll your body weight a little bit that way. Good, pause right there. You doing okay?
Yep.
What do you feel?
My butt cheek.
Yeah? Left or right?
Left one.
Go ahead and relax. All right, I'm going to help you turn the volume up on this, okay?
Okay.
All right, you're going to be screaming by the time we're done with it. Okay? Good. Right there, you go with that?
Mm-hmm.
Go up for me. Pause. Stay right there. Don't let me push you down. Lower down real slow. How you doing there?
Good.
Left butt cheek?
Mm-hmm.
How's your left shoulder?
It's okay.
Okay, roll up here. Here, hold. Come on down real slow. I like that you're doing a good job breathing. Okay. Okay, we're going to roll in again. Right up there. Hold it. Looks like you can roll a little bit further. Does that turn that cheek up?
Yep.
Turns the volume up. On your boom box. Come on down real slow. Okay. This time I'm going to give you this right hand on the floor. There you go. That's to help support. And take your left shoulder out of the equation a little bit more because I don't want that guy to take away from what this left hip is doing. Good. Slow on the way down. One more time like this. Then we're going to go into a different version of the same thing, which is a high position to help spare your shoulder a little bit more. You're shaking.
Oh, it's because it's hard.
Okay, left hand on the ground, elbow up, straight arm. There we go. We're going to slide this guy down a little bit here. Let's go here. There you go. Let's go ahead and roll in. Pause right there. We're going to go up. Hold that. Roll in some more. Hold that. Stay. Come on down. One more like this, and we're going to change the variation one more time, okay? Good. Come on down. This time put your right hand out there too. There you go. Reach a little bit further. There you go. Let's roll in again. Pause right there. Come on down. This is going to be the last one, okay?
Okay.
But I want you to hold it until you hate me.
I already hate you, Seb.
Halfway down. We're going to get extra spicy then since you said that. A little bit down.
God.
A little bit down. Pause. Stay right there. You want to talk about it?
I want to elbow you in the face.
Okay, go ahead and relax. Okay, go ahead and stand again. Let's check out how your movement feels now. Let's see if it still feels. Oh, your butt cheek on fire.
Yes, it is. Whew. It feels smooth.
It sounds smooth.
Do I look centered again?
You sure do. You're
So
not
my left lazy leg syndrome's gone?
Yeah, we've corrected your left lazy leg syndrome. Look at that. You want to go limbo later?
Wow. Feels great.
Yeah.
So what do I do going forward from here?
So you have a few exercises you got to be doing at home. The first one, skin rolling, is a really nice, easy way to do medication. It really is not as upsetting to your stomach as things like over-the-counter medication, and you can still take some of your pain away. So you're going to do that a couple times a day, not to pinch yourself, but to grab and scruff yourself.
Okay.
The other exercises on the ground, which I guess we only did one, that one, if you can do pretty intently like we did, probably a couple days a week. You don't need to do it every day, but I don't need you to do a bunch of reps. I need you to do enough to where you feel like you hate me.
Okay.
If you can do it in that intensity, then only a couple days a week. But if you can't, you can go more of like high reps and low effort and so on. And you'll probably still get the same result, but I think I find that the effort-based one works a little bit better.
Can I do that without a partner?
You sure can. You just use the floor to push down onto you. The world is your weight stack. And so you push down onto the weight stack, it'll have the same type of shake effect. But it's always nicer to have someone push on you because it's easier reactive feedback.
Should I do it on the other side?
I don't think you need to, but for good measures, I have no problem if you do.
Okay.
Okay. If you guys have any problems like this, like degenerative disc disease, and you've had MRIs and X-rays that show such, we can help you. As you can see, when we worked with Dawn, her range of motion improved pretty dramatically, and her pain dropped pretty well after just doing 2 interventions. So if you're looking to see if we can help you, we have discovery sessions that are consultations, and we can figure out what's going on with your case and figure out if we can actually take you on or not. So if you like the channel, subscribe to the channel, like the video. We'll see you next time.